Good morning and welcome to our series on COVID. We're really kind of sad we have to continue this series, but we're getting close, everyone. Days are getting brighter. It's a good time. And now with the vaccine here and on the horizon for new ones, things are getting better every day. We've been having a lot of conversation across our community about the vaccine. Where can people go to get it from the different healthcare providers? So today we brought all of our healthcare providers together. So we have representation from Prevea, from Holy Family, from Aurora and Bellin. So we greatly appreciate everybody here today. Each provider is going to have about 10 minutes to give an update from their respective facility. And then after that, we will have a little bit of time from each of them for question and answers. And whoever can stay on, we will have time at the end also. So we are going to get rolling right now. And our first speaker for today is Dr. Rye, representing Prevea.
Morning, everyone. My name's Ashok Rai, the president and CEO of Prevea, and hopefully you can hear me okay. And wanted to just give you a brief overview of what we're seeing at Prevea from a COVID perspective, and then jump right into everybody's favorite question about vaccines. So as it stands today, our hospital volumes are lower than they had been previously during our surge, but COVID's definitely not gone. We still have about 24 patients between St. Mary's and St. Vincent's admitted to the hospital. That's a good amount of people if you think about we're busy overall with everything non-COVID as well. So it wouldn't take too many more patients to put us back into what would be into that surge type situation. So COVID is still very much within our communities, and we're seeing that every day. Our testing volume's a little down, but I think a lot of that's because we forgot to make sure that everybody knew COVID was still around, and encouraging testing even for the slightest symptoms. So the runny nose, the sore throat, the cough, the same things we've been talking to you about, but making sure people are getting tested. We do know in the state of Wisconsin right now that what's best known as the UK variant, or B117, has been seen in our state, and it spreads a lot faster and a lot more efficiently than COVID that we are used to seeing, or that first strain that we had seen. Why does that concern us right now? Well, we understand that if our mitigation efforts are not doubled down on, in other words, if we're not doubling down on masking and physical distancing, that the spread would happen much faster. So the new variant won't make you sicker, but more people will get it. So statistically, that means that it will get to people that are more at risk. So more people will come into the hospital, and unfortunately, more people will pass away. So right now in the state of Wisconsin, we're at a very tenuous point where we need to be very, very vigilant now that we know that strain is here. We've seen what it's done in the UK. We've seen California, which still is undergoing, a pretty big surge. And we are on the verge of more problems here in Wisconsin. So how do you prevent that? Once again, getting that masking going, making sure that we're physically distancing, test. There should be no reason you shouldn't get tested. And all health systems, we communicate all the time. We all have capacity to test you, not just Prevea, but everybody does. So feel free to go to our website and make sure you get tested. To jump into everybody's, what's the other solution is how fast can we get everybody vaccinated? Well, that's not up to the state of Wisconsin, and it's not up to any of my colleagues on the phone here or on the Zoom here today. That's really up to the supply from the federal government. All of us continue to scale up our efforts. I can talk towards Prevea's efforts. We are trying to go from that smaller site version because of the technicalities of this vaccine. It's not easy to do within a clinic site. You got done seeing your doctor and quickly will vaccinate you. It needs to be scheduled, and how the vaccine is transported. So we have found it's much better to consolidate into larger vaccination sites. So our first largest vaccination site opened up last week at University of Wisconsin, Green Bay. Yesterday, it did 997 first shots. Tomorrow, I think it's scheduled to do over 1,000 first shots, and we continue to go forward in ramping up more sites. Got to remember, we're not operating at full capacity because we have to be ready 3 weeks from now to do that second shot. So we're really talking first shot numbers, knowing that second shots are going on at the same time. Our second large site will open up on the west side of the state for anybody who cares about Eau Claire. And then just south of you in Sheboygan on February 4th at UWGB Sheboygan, our site will open up. And then farther to the north on February 8th, UWGB Marinette will open up. We are in conversations right now with Chancellor Alexander and President Tommy Thompson about UWGB Manitowoc and what our presence there would be in our UWGB partnership. Wanted to get the other 2 sites built. They're actually built as of today. I think they're doing some cleanup at Marinette, and then we would then continue that partnership with the UW system. When we talk large sites, each one's going to have a different capacity, and really, once again, it's not our decision on who gets to get vaccinated. I want to clarify that on the behalf of a physician on here, but for all my other healthcare partners, it's the state of Wisconsin that sets the rules on who gets the vaccine, and it's the federal government that somewhat sets the supply on how much we get. So it isn't for a lack of desire for us to have more slots available for you to schedule. It's really about those 2 factors converging together. But our supply continues to increase week to week, and we heard great news from the federal government that next week we all expect more. So the easiest way for our system to figure out how you can get vaccinated and if you qualify for a vaccine is to go to prevea.com/vaccine. We have online ways for you to schedule, which is the easiest and probably the fastest, but we also have a 1-800 number for you to schedule as well for those that are not comfortable with the internet or don't want to create an account. Both will get you into somebody to talk about getting vaccinated. As far as who can get vaccinated in the state of Wisconsin right now and at our sites, because we follow the DHS guidelines, we have to, otherwise we'll get in trouble and won't get more vaccine, is everybody what's called 1A. So that would be what you would generally consider your healthcare workers, whether they be direct care healthcare workers or those that are physical therapists, occupational therapists, those that are helping keep the healthcare systems going. Then fire and EMS was added in. And once again, in there in that 1A, there's dentistry and there's other aspects. Chiropractors are all included in 1A. A good majority of them that want a vaccine have now received it. So the state said, let's move on to that next phase of really critical people that we need to keep the society going: fire, EMS, police, correctional officers. A good majority of them have also been vaccinated, those who want the vaccine, and we continue to see some of them. And as many of you know, last Tuesday, we got an email from the state that we could start vaccinating those that are 65 and older. They said initially start on Monday, January 25th, but then they said, oh, by the way, if you have availability, do it earlier. So some of us started doing it earlier, but I'd say the real surge of that is happening now. Actually, 96% of all appointments at Prevea for this next week are all over the age of 65. Why is that important? If you really were to look at our inpatient census and those who passed away, the good majority were over the age of 65 or had some sort of chronic medical condition. So we're dealing with those that are over 65, and hopefully soon we can deal with those that have other medical illnesses. Many of you may know that yesterday the state of Wisconsin said, what's the next phase? And that's really going to start on March 1st. And they put a long list of the next phase out, but that list is actually in a priority order. You kind of have to read the fine print on that. So the first part of this next phase will be educators. And then there are other categories that fall. We don't know if they'll turn on educators plus another category on March 1st or just educators, but we know for a fact that educators will be the first to go. They actually put them in a priority order list. And you can find that information on the Wisconsin DHS website. If you Google Wisconsin and DHS, look up vaccines and you can see who's eligible. So March 1st, if vaccine supply is there, and if all of us on this call do a good job in getting enough 65-year-olds vaccinated in this next month, we'll now open up to the educators and possibly more in the coming weeks after that. So for scheduling right now, those who qualify can schedule, and we know who qualifies now, so they can schedule for right now. That would be the 1As and those 65 and older police, fire, and correction officers that I talked about. Educators are going to have a plan here in the coming week, but they won't be able to get their shot until March 1st. But scheduling and plans are being done.
All right, I think we've temporarily lost Dr. Rai. He warned us he might be having internet problems. So, and I think I was going to wait 1 second to see if he is back.
I'm back.
But you're fading out. We knew this was going to happen. Well, at least you were very close to the end of your segment, so that works out well.
I would take questions. I don't know where it got cut off.
So if we have a few questions from those viewing.
So Spanish and Hmong capability. Right now, if you dial our 1-800 number, we can get you an interpreter if a language is stated that you would need. And then once on site, for Prevea, we have Marty, which is a mobile interpreter on video that has 140 languages built that we can dial into. So there's mobile interpreter site services there. We're also partnering with Casa Alba in Green Bay to figure out how we could be better for scheduling for those that speak Spanish. And then we reached out to the Hmong population as well to see how we could be better, and waiting to hear back from them. So working through those resources, but our 1-800 number, I think it's a 1-833 number, has those resources as well.
All right. Should we take this last question, Dr. Rye?
What do you expect the wait for the vaccine appointment to be open for those 65 and older? So, right now, and I can only speak to Prevea, I know my colleagues all are struggling with the exact same thing I am, is none of us have a federal government crystal ball on allocation right now to the state, and then the state redistributes it to us. I would say that right now it's, and this is only for Wednesday, January 27th, the data changes every day, that I would check back on a everyday basis with your health system, because as allocation starts to get moved around from site to site, or more news comes from the state, we continue to open up more slots. And I wish there was a better answer for that, but right now the predictability is a little bit low, and none of us want to get in the position of scheduling somebody for a vaccine and then calling them up and canceling. So we are all just trying to be very conservative with our schedules and open them up as allocation becomes available. So I know that may be a frustrating answer, but I would check with the websites on a daily basis as more slots open up, not only for today, but for going forward.
All right. Well, thank you so much, Dr. Rye. We greatly appreciated you coming on and sharing all your information with us. So if anybody has any questions specifically for Prevea Health, they can send them over to us, and we will have somebody who can get in contact with you. So thank you very much. All right. Up next, we have representative from Bellin. Randy, would you like to take it from here?
Sure. Hi, everyone. Good afternoon. Randy Van Straten with Bellin Health. I'm the VP of Business and Community Health at Bellin. Happy to be here sharing. I think Dr. Rye did a great job talking about the community and the situation. I mean, our numbers follow what Dr. Rye mentioned. We are seeing a trending down in our volumes at our hospitals, also a trending down in testing. However, you all being key in the community, it's not time to let our guard down. I think that is the key. So at your workplaces, make sure you continue to encourage all the things that we've been talking about. Now is not the time to let the guard down. Okay. Yeah, there's hope on the horizon here, but our awareness needs to stay solid together in getting through this. So I think that's the key message there. I do have, now I can pivot here to the vaccination here. I'm going to share this. All right. Can you see my screen where you see the picture of the hospital? Wonderful. Thanks, John. I appreciate the head shake. Then I'm going to go to, so we'll talk a bit about vaccines of where we're at. So individuals do not need to be a patient of Bellin Health to be vaccinated at Bellin Health. And I think the message here, and I think John and Tom and Dr. Rye would all agree, we are all in this together. We are all in this together to help our patients out in the community, because the more patients we get vaccinated in the community, the less we're going to have the spread, the less we're going to have mutations and things going on. So we just wanted to make that. I know I worked our vaccination site Thursday, Friday, and Saturday, and I know 50% of our patients were Bellin. They were Prevea and Aurora coming in through our doors. And that site that's open now is our Bellin Health Schwabenen Clinic campus. That's that big campus out by the airport. As you get out to the airport, we have basically converted a gym into a vaccination center. So it's not typically where we do vaccinations, but it's in the gym, and there's a convenient door with signage directing folks to actually the northwest side of the building, so you can quickly go in that door. It's open 7 a.m. to 5 p.m. right now, Monday through Friday, 8 to 4 Saturdays and Sundays. I know last week we vaccinated upwards of over 500 people per day there. We're gearing up to now over 800. We also will be transitioning to a new site in Green Bay, coming soon to a larger location to be announced. And we're going to announce that probably coming up next week. It's in the planning now, and but as of right now, the Schwabenen is our west side site at the clinic. Oconto is up and going. We moved to our bond center, our community bond center, where we're actually vaccinating in the gyms there that we have, and that works out Monday through Saturday. Again, as Dr. Rye mentioned, our appointments and our vaccinations basically are dependent on the volume, so the days that we're open. And then we are opening up tomorrow up in Marinette at our Marinette Clinic campus on Roosevelt, and that'll be available Monday through Saturday and too as scheduled. So those are our locations right now. Scheduling, how to schedule, mybellin.org. You can go out on that and schedule. There's an attestation that you just you answer questions to make sure you fit within the category that's available by the state. And we don't make those decisions. That is, we follow the state's orders. We have been pushing out email reminders to folks that if they qualify, for example, for our 65 plus and they have an account with us, pushing out reminders, giving them a nice click on and a fast path to basically get on and schedule. And then obviously you have our, I've got our hotline here, a local hotline and an 800 hotline for folks to schedule. So that is kind of the basics. Happy to entertain any questions also.
Andy, can you see the questions in the QA box? There's quite a few there if you'd like to answer some of those.
Yeah. Let's see. What do you expect the wait time to be for a vaccine appointment, or expected time when an appointment will be open for those 65 plus? Okay, great question. Couple things that this depends on. As we build more efficiencies with our sites, we are opening up appointments. Okay, so we're gradually ramping up. As we move to a larger site, we'll be opening up appointments. So it's something that you just want to keep checking, because we may open up appointments today and be available today or tomorrow based upon our supply also, because that, that is a limiting factor, is the supply and the amount of vaccines that we have. So it's something to check back regularly. Right now, I think we are booking towards the end of February, early March right now for those appointments. But like I said, as we expand our facilities and get more vaccines, hopefully in the future, we'll be able to open those up. I know on Friday, we opened up 2 slots every 10 minutes and they were filled within 30 minutes. Let's see, can home care workers fit in the current group to be vaccinated? Can home care workers, and underneath 1A. So if these home care workers are doing frontline care, frontline direct patient care, they would be eligible for that. I do have, a detailed list of all those that qualify within 1A. And Karen, I could email that to you if you want to send that out to your members too, but I've got the very detailed list within 1A that I got from the state.
That would be great. Thank you.
Let's see, other questions here. I'm an educator at a not-for-profit organization and work with the public and children. Do I qualify for the vaccine starting March 1st, even though I do not work for a school district? Boy, I don't know if we have the detail yet on that 1B educator yet. That's a great question. And again, March 1st is even tentative in the announcement. So it's tentative. We don't know yet, and we don't have the detailed, very detailed description on that yet. So as that comes out, I think, Karen, we can get you that to get out to the members too. Unless Tom or John has a further in-depth view of that. Unfortunately, I don't. It's a pretty general information. And then what I'll do is I'll try to dig into that to the state announcement when Tom and John are on, and see if we could actually share that at the end. Is there a preference between the Moderna versus the Pfizer vaccine? That's a very good question. What we're seeing is that the Pfizer is going out to more of the, call it the metro areas, and the Moderna is going out into the rural areas. And that is based upon the logistics and the controls that are required within both vaccines. So the Pfizer is that deep freeze one, right? So there's a lot of logistics that go with that one. And you know, I'm not a physician, but I haven't heard any real preferences between the two. I think if you can get a vaccine with either, you're doing darn good, because both these vaccines are very, very well done. Let's see, same question. I was reviewing the information as well as registration materials for vaccine. I didn't see Spanish language. Norman, can you share them with me? Yes, we are working on that. We do have the 800 number with the translators, like Dr. Rye mentioned, also at Bellin. And we are expanding that, you know, to make sure we have equity across all areas. We have many of this stuff because we work directly also with the meatpacking plants, and we have been working with our meatpacking plants to get those folks in 65 plus in that. I just don't know if those materials are on the web now, but that's a good call out. How do you check these appointments? Okay, what you can do is you can go into mybellinhealth.org, register as a user of mybellin.org. Then what you can do is go through the attestation and answer some questions. And then guess what? A schedule pops up, and you can click on the time, and the times only appear if they're available. Okay, so you can do that. Let's see.
All right, Randy, I think your time is up now, Randy. So we're trying to keep everybody right on schedule because people are really busy with everything that's going on. So thank you very much. And for those of you putting questions in, continue to put the questions in, because the next speaker is more than happy to answer those. So Randy, thank you so much. And I know we're going to have either you or a representative stay on to the end to answer more questions than two. So thank you. All right, up next is John.
Hi, good afternoon, everybody. My name is John Burris. I'm the Senior Director Administrator for Aurora for Manitowoc County. Very similar to Randy and Dr. Rye. They've done the heavy lifting, describing the situation we're in. Our hospitals are seeing slightly lower volumes. We are still seeing COVID all over. We may not be hitting the peaks and making the national news, but it is still here. And to reinforce what Randy said is, we really have to be vigilant yet. Even as we're getting vaccines and we're going through that process, it's still a little longer road than people want it to be. They want it to come quicker, but it's going to take us some time, one, to get the vaccines out, but two, to ensure that we have that immunity established before we can start taking our foot off the gas, as it were. As far as Advocate Aurora, I won't go into the details of each of the vaccines that we're doing, but throughout our system and every one of the markets, we have vaccination sites, small and medium vaccination sites at hospitals or clinics in those areas, up to and including some what we're calling mega sites, mega vaccination sites that are generally larger sites that we team with local community entities to increase the size of intake to distribute those vaccines. Similar to the other organizations, the vaccination, we are controlled by government regulation and order on who we can give vaccinations to. We are in the 1B phase of giving plus 65 patients and over the vaccine. We are still giving first and second doses to the 1A individuals that Dr. Rye and Randy referenced, to healthcare workers, first responders, police, fire, etc. And then we will start on March 1st, adding to that list the 1B essential workers, which include the educators and public transit. And to that question with that home educator, I think there was somebody that was unaffiliated. I think they do fall in that category. We actually had that answered already. Somebody had brought that up, so they would fall into that educator category. Locally for Manitowoc County, for those of you in Manitowoc County, we are giving the Moderna vaccine here in Manitowoc County. We are a smaller site. It's a little easier for us to give the Moderna. As Randy alluded to, the Pfizer vaccine it requires a very deep freeze for storage and then a thawing period. And larger sites can do that at a little bigger bulk than we are available at this point in time. Our schedule is open to both a 1A and 1B at this point in time. Visiting advocateaurora.org will give you, direct you to the appropriate way to set up an appointment for our patients that are current Advocate Aurora or My Advocate Aurora members and have the Live Well app and have signed up. We are sending out email invitations for them. That's happening currently. Again, reiterating the availability of vaccine is what is driving our schedules. So at times we would see our schedules be wide open, accepting as many patients as we can, but controls of the vaccine and what the government has distributed have us regulating how many spots we have open. The biggest concern for us is as we give the first vaccine, we need to make sure we have that second dose vaccine for that person a month later when they have to come back for their second dose. So it's really kind of a difficult, I would say, process to pinpoint and be black and white with and say absolutely this and absolutely that with volumes and when we can do it. So I know that all of the organizations that are on the call are struggling with, wanting to give the great patient care that we all give and give it the way the patients want it, when they want it, how they want it, and having to deal with being regulated on the doses that we get and how long or how often we get them and how much we can get at a time. Advocateaurora.org is our site. Live Well app we have for those of you who are Aurora patients. Great information on there. The one question about the Spanish and Hmong registration info, I will get back to, same as Prevea and Bellin, we do have interpreters and availability for that when the person calls and gets on the site, but I will check to see if there's a link to get them to that information on the website and then send that information to Karen along with the toll-free number, the 866 number we're asking patients to call related to that. I see a couple of questions related to the immunocompromised. We are recommending that anybody that has some higher risk disease processes or they're immunocompromised to discuss with their primary care doctor the steps they need to take to get this vaccination. We still have to regulate what categories they fit into and vaccinate according to the government categories. But there are some circumstances when those types of patients that necessarily don't fit the age category or the work category, but may fit in a different category. So definitely reach out to your primary care doctor, ask them for advice, and they should have some information for you to be able to be taken care of and have access to the vaccine. That's all I have. Not to repeat, go ahead, Karen.
Okay, I have a question because I know this has been asked in the community. So if you do not have an email address, because you said you're reaching out to the patients, and I'm sure it's the same way with the other facilities too. But there's a lot of people within our community who don't have email addresses. So what is their best bet to get an appointment scheduled if they're in one of those two groups? Should they be calling their local provider directly and getting in touch with the nurse to get that appointment scheduled?
Yeah, so that's a great question. It's actually a very hot topic when we first started. We are actually, in addition to sending emails out, if they don't have email, we're sending text messages out. If they don't have a cell phone and they just have a home phone, we are starting to call patients directly to get them scheduled for their appointments. if they aren't contacted by either of those methods, they can call the 800 or the 866 number, again, which I'll provide for you later. But yeah, they can contact that number to work to set up their appointment. It's a great question.
Do we have any other questions coming through? I think for right now, we're good on the questions. So I guess I'll say thank you very much to you, John, and for Aurora coming through and helping us with this. And we will move on to our next speakers. And if you can stay on, John, just in case there's any questions, that would be great. So, all right, I believe we have Holy Family Memorial up next. So
Good afternoon, all, and thanks for joining us today. I'm Tom Veeser. I'm the Vice President for Quality and the Chief Nursing Officer here at Holy Family Memorial. A little background of our current trends with the COVID-19. We too are down on our hospitalizations. We've seen a correlation as we've increased those therapeutics, that we've had fewer hospitalizations and fewer people on the vents. So I do stress until everybody gets the vaccine, remember, these therapeutics are effective, so continue to get tested if you have symptoms. And if you qualify, consider having the therapeutics, which we do on an outpatient basis. We continue to test in our respiratory clinic and our drive-through. And again, testing is very key. One point before I get into the vaccinations is the state just decreased or just lifted the mandatory mask mandate. I can tell you at Holy Family, we find masks to be very effective at stopping the spread. So I would encourage all to continue the mask wearing. It is very protective for both the individual who may be unknowingly contagious and the people trying not to get the infection. Related to our vaccination process, I think the information is going to be fairly repetitive. Here at Holy Family, we use the Pfizer vaccine. We do have the freezer that we have for storage, and supply is our main issue. So depending on how much supply we can get week to week is how we can offer that. We have completed the voluntary first round of 1A, including the police and fire and other people in the community that meet that qualification. We started our 65 and over end of last week, and our regular clinics throughout the week here at Holy Family. All of our slots, however, are full for this week. What we will be doing, and I'm going to share my screen. Tell me if you're seeing that right now.
we can see it, Tom.
All right, so you can see where you can register here online for the vaccine as needed. And we will be putting that up every Friday as we get our supply and we are able to provide the open slots. Trying to get back to my main screen here. So I believe that's the key updates that I would have for Holy Family, and I'm able to take any questions.
Tom, I can ask a question that I know people are asking too. So where are you vaccinating people? Is it at your different locations?
Yes, we are vaccinating only at the Holy Family campus at this time. We have, you can come in through the western entrance, and that's how we're doing that.
Okay, great. And then there's also a question that came in the chat box, and it says, if we are a member of Holy Family Memorial and registered, will we be notified?
You receive a confirmation when you apply or when you register online. And I believe that's the confirmation that you'll know if you've been registered.
Great. All right. Do we have any other questions out there? Please feel free to put them in the Q&A or to put them in the chat box. Otherwise, as all as our speakers have shared with us, they're going to be sharing their information with us. So we will be posting that on our website. And we'd like to please remind you too, this is being recorded. So if you think there was a lot of good information, which we do, then please share it with other people, and we'll be putting it out on Facebook so that you can do that, just that. So, let's see. I think that's all the questions that we have. So thank you very much, Tom, for coming in and helping us and letting us know what Holy Family is. And once again, I want to thank all of our providers. They're doing a great job. And I have to agree with everybody. Keep those masks on. We're almost there. We're almost there. So, all right. Well, thank you all so much for coming, and we'll talk later. And I hope you enjoy the rest of your day.